Have you ever felt aching feet or noticed that your balance isn't what it used to be? As we age, our bodies go through many changes, and one often overlooked part is our feet. But in reality, taking proper care of your feet is one of the most important things we need to pay attention to once we reach our 80s. Our feet carry us throughout our lives, supporting every step we take. And if we don't take care of them, many problems can affect our mobility, independence, and overall quality of life. In today's video, we will explore why foot care becomes even more important once we reach our 80s, and I'll share some simple yet effective tips to help you maintain healthy feet. By the end of this video, you'll better understand how small changes can help you stay active, feel comfortable, and maintain the independence that we all cherish. Let's start with a common issue many of us may face as we age: foot pain. You may begin to feel a slight pain somewhere, but if not addressed in time, it can quickly become a more serious problem. Have you ever noticed that after a long day, your feet feel sore or swollen? Or perhaps you've dealt with calluses or bunions on your feet, making walking difficult. These issues aren't just inconveniences. They can be signs of a more serious problem developing. At our age, it's normal for the tissues in our feet to lose some of their elasticity. The cushioning that helps absorb shock for our bones and joints also begins to thin, and our muscles may weaken, making it harder to maintain good posture while walking. The pressure from daily activities, combined with wearing improper shoes, can cause pain in areas like the arches, heels, and toes. But the important thing to remember is that taking care of your feet isn't just about easing pain in the moment. It's about preventing long-term problems that can affect your balance and mobility. The first step in proper foot care is making sure you're wearing the right shoes. Shoes are not just a fashion item. They are an essential part of keeping your feet healthy, especially as we get older. But with so many options available today, how do you choose the right pair? You need shoes that offer support, comfort, and stability. Avoid high heels or shoes with narrow toes. Choose shoes that provide enough room for your toes to move comfortably and ensure that the shoes offer adequate arch support to prevent your feet from feeling fatigued after a long walk or standing for a few hours. For example, look for shoes with a soft but firm sole, a wide toe box, and cushioned insoles. If you've been wearing shoes that aren't providing the proper support for your feet, that could be the cause of your pain. Taking the time to select the right pair of shoes will not only reduce pain, but also minimize the risk of developing serious foot problems in the future. Now, let's talk about another issue we often don't think about: toenail care. As we age, our toenails become more prone to drying out and thickening, which can lead to ingrown nails or fungal infections that cause pain. Keeping your toenails trimmed and clean is an important step in preventing these problems. But remember, don't cut your toenails too short. Trim them straight across. Avoid cutting too close to the skin, and avoid cutting into the corners of the nails. If you notice your toenails thickening or changing color, it could be a sign of infection or another issue that needs attention. In this case, you should consult a doctor or a foot care specialist. However, foot care isn't just about the outside. It's also about blood circulation. As we age, blood circulation to the feet may decrease, leading to swelling, discomfort, and even increasing the risk of blood clots. Elevating your feet when resting, performing simple stretching exercises, and wearing compression socks can help improve circulation. You can also massage your feet daily to encourage blood flow and relieve tension. This small act of self-care can make a big difference in how your feet feel each day. Foot care is not something distant, but it is an essential part of maintaining our health and independence. Without healthy feet, simple tasks like walking to the kitchen or visiting the doctor become difficult. As we have discussed, choosing the right shoes and taking care of our toenails are the first steps to maintaining healthy feet. But that's just the beginning. So we've talked about the importance of choosing the right shoes and caring for toenails. But that's just the first part of the story. Let's continue exploring more foot care tips that will help you maintain healthy and comfortable feet in your 80s. One important factor we cannot overlook is proper foot hygiene. As we age, the skin on our feet tends to become thinner and drier, which can lead to cracks, infections, and discomfort. Daily foot hygiene not only helps you feel clean, but also prevents potential problems such as fungi, bacteria, or dermatitis. The correct way to wash your feet is not complicated. First, ensure you wash your feet daily with warm water and mild soap. Avoid using water that is too hot, as it can dry out the skin and harm the soft tissues. After washing, gently dry your feet, especially between the toes, as leaving them damp can create conditions for fungi and bacteria to grow. Don't forget to apply moisturizer after drying to keep your feet soft and prevent cracks. In addition to hygiene, another important factor is checking your feet regularly. As we age, our feet not only endure more, but are also more likely to experience problems that we may not notice immediately. Make a habit of checking your feet, especially for those with diabetes or poor circulation, as they are at higher risk for serious issues such as ulcers or infections that may not cause immediate pain. Check for cuts, wounds, or calluses on your feet. And if you notice any unusual signs such as swelling, redness, or changes in skin color, be sure to see a doctor. This is especially crucial to prevent minor issues from becoming more serious health problems. Now, let's talk about another essential aspect of foot care: exercise. Yes, even as we age, our feet still need to be exercised to maintain flexibility and strength. Doing gentle daily exercises not only helps keep the leg muscles strong, but also improves circulation and reduces fatigue. One of the simplest but most effective exercises is moving your toes. You just need to sit comfortably and lift each toe up and slowly lower it. Repeat this exercise for a few minutes each day. This helps strengthen the muscles in your feet and improves joint flexibility. Additionally, walking gently around the house or outside in the yard is also beneficial for your foot health. Another easy exercise to do is balance training. Maintaining balance is crucial as we age because it helps prevent falls and unnecessary injuries. You can stand up straight, holding onto a support if needed, and try to stand on one foot for a few seconds, then switch feet. This exercise helps improve stability and balance, which is very helpful for older adults. And don't forget, foot care isn't just about preventing illness or easing pain. Healthy feet are what help you maintain freedom in your daily life. Imagine not being able to stroll in the park, go grocery shopping by yourself, or participate in your favorite activities simply because your feet aren't healthy anymore. That's why maintaining a regular foot care routine is so important. Proper foot care not only helps reduce pain, but also brings comfort and confidence in life. Healthy feet will help you keep your independence, walk freely, and enjoy a long, fulfilling life. So together we've explored many important tips for keeping your feet healthy, from choosing the right shoes, proper foot hygiene, regularly checking your feet, to performing gentle exercises to maintain flexibility and strength. But the journey of foot care doesn't end here. Let's continue exploring some final tips to ensure your feet stay healthy and help you maintain an active, independent lifestyle in the years to come. One crucial aspect we can't overlook is foot skin care. As we age, our skin becomes more vulnerable, especially on our feet. Dry, cracked skin, or even calluses, can not only make the feet less aesthetic, but also lead to pain. Daily foot moisturizing is essential. After washing and drying your feet, apply a special foot cream to keep the skin soft and elastic. If you have cracked heels, you can use specific creams for healing and moisturizing. If the cracks are severe, don't hesitate to consult a doctor or foot specialist for advice. A real-life example is Mrs. Helen, 75 years old, living in California. She had cracked heels during the winter, which caused her significant pain while walking. After consulting her doctor and receiving guidance, she started using a special moisturizing cream for her feet, and her condition improved significantly. Mrs. Helen can now walk comfortably without worrying about painful cracks. One common issue among older adults is arthritis. Arthritis can make movement difficult, and the feet are often one of the most affected areas. If you're facing this issue, it's important not to let the pain stop you from staying active. Gentle stretching exercises, combined with methods like hot/cold compresses or using pain relief medications as recommended by your doctor, can help reduce pain and maintain flexibility in your feet. Think about Mr. John, 78 years old, living in a suburb of Texas. He suffers from arthritis in his knees and ankles, making long walks difficult. However, he started doing gentle stretching exercises and applied hot compresses every night. He also consulted his doctor and used appropriate pain relief medications. As a result, he's experienced less pain and feels more comfortable participating in outdoor activities, such as walking in the park with his wife every morning. Additionally, remember that your feet reflect your overall health. If you have circulation problems, diabetes, or cardiovascular issues, these will often manifest in your feet. For example, if you notice swelling, ulcers, or coldness in your feet, it could be a sign of a serious health condition. It's crucial not to ignore these signs and to regularly check the health of your feet to catch potential problems early. We can mention Mrs. Linda, 82 years old, from Florida, who has had diabetes for a long time. She regularly checks her feet because she knows diabetes can lead to serious complications if not properly managed. One time, she discovered a small ulcer on the sole of her foot, and she immediately visited her doctor. Thanks to early detection, she received prompt treatment and avoided more serious complications. Daily foot checks help her maintain her health and reduce the risks posed by diabetes. A final tip I want to share is that maintaining a healthy diet also plays a significant role in protecting your feet. Foods like salmon, walnuts, or those rich in vitamin D and calcium will help strengthen your bones and joints, keeping your feet healthy. Remember to drink enough water, as water not only keeps your body healthy, but also helps keep your feet's skin soft and reduces the risk of cracking. Mr. George, 70 years old, from New York, shared that he began incorporating calcium and vitamin D-rich foods into his diet after his doctor advised him to do so to improve his bone and joint health. After a while, he felt healthier, and his feet no longer felt sore when walking. He also made sure to drink plenty of water daily, keeping his feet from becoming dry and rough. Finally, I want you to remember that foot care is not just a necessary task, but a way to maintain your independence and enjoy life. Healthy feet allow you to continue engaging in your favorite activities, from walking in the park to meeting friends or shopping without worrying about pain. Taking care of your feet is a way to maintain freedom and good health in the golden years of your life. For sure, with just a little time and care, your feet will remain healthy and support you through every journey. Never underestimate the importance of foot care because they are the key to maintaining your mobility and enjoying life to the fullest. Remember, small changes in your foot care routine can make a big difference in your health and quality of life. Feel free to share your experiences or questions in the comments below this video. I'd love to hear your story. If you found this video helpful, don't forget to click like and subscribe to the channel for more useful health tips. Wishing you healthy feet and a fulfilling life every day, no matter your age. Live your best life because you deserve it.